everyone. It's Dr. Glenn Vo, and sorry for the late start. We got Dr. Liao on. Dr. Liao, welcome to Nifty Thrifty Dentist Facebook group. How are you?
Hi, great to join your group.
Yeah,
it's an honor and a privilege.
Yes, and I made it fairly difficult for you today, right? I gave you a lot of instructions, some new technology, and it took us a while, but here we are. I'm so happy that we got you on.
Great, glad to join you.
Okay, so the reason why I brought you on is because I have so many members. They've been talking about the Vivos system. They've talked about you and your books and whatnot. And so I wanted to bring you on because you're one of the experts in this field here. And guys, if you're now just joining, again, I apologize. You know, we had some technical difficulties, but if you have any questions, look, Dr. Liao, he's a very busy man. He's speaking, he's practicing, he's writing books, you know, so if you have any questions, type it into the comment section. I'll make sure I get it to him. So Dr. Liao, let's start with, how did you get started in taking care of these type of patients with obstructive sleep apnea?
Sure. I came from a general dentist background. I was a board certified general dentist. Believe it or not, there's such a thing. I'm an MAGD. And I eventually became a biological, or what's commonly known as a holistic dentist. And how I came into this is really through general dentistry. I was always interested in teeth grinding as a phenomenon. Teeth grinding never made sense to me because why would the body destroy the hardest tissue it has? So as a general dentist, most of our schedules are filled with the consequences of not dealing with teeth grinding head on. Patient breaks a cusp, they needed a crown turns into an endo turns into a fracture, and a fracture turns into an implant fails. Now what do you do? So sooner or later, you're gonna have to confront airway as an issue. And I'm just gonna tell you that my conclusion from 35 years of professional quest, ever since I got into dental school, I wonder about teeth grinding. My conclusion from 35 years of digging all over creation is that teeth grinding is just one frame in a movie. The movie is called Airway Obstruction During Sleep. So what sleep medicine research has done is shown that teeth grinding can be treated and stopped when apnea and hypoapnea is not a problem anymore. In other words, it's an airway problem. That's the reason why night guards do not work.
And I'm glad you brought that up.
Sit down with your patients and you ask them honestly, I'll give you $10 if you tell me the truth. They'll tell you they don't wear the appliance they pay you for.
Right.
Whatever that amount is, okay? So the question is, why? So why do we keep doing this? What's the definition of insanity? And so if you want your dentistry to hold up, whether it's your veneer, your ortho, your crown bridge, your fillings not to be persistently sensitive, you have to address the airway.
You know, and here's the thing. I mean, what is your philosophy as you know, when someone is grinding their teeth and we just, you know, take an impression and just give them a night guard. Here you go.
Right.
There you go. There you go,
right.
buddy. Give them a pat on the back. Right. All right. I'll see you in 6 months.
Right.
What are we doing there? What are we doing there when we do that?
Right. So what we're doing is we give them a different surface to grind on in the name of protecting their teeth and your restoration. But we're not looking to treat the cause. And what study has shown, this is sleep medicine research, is that teeth grinding is centrally mediated. It's not a peripheral phenomenon. That means that the brain is in charge of the teeth grinding, not the teeth. So when the dentist want to treat teeth grinding, they have to get inside the brain where signals are going when the patient is turning on code blue. That is during airway obstruction episodes.
And so, you know, as general dentists, look, you are a general dentist, and let's kind of dive into what your what your practice is like right now. So let's start with this. You're still a practicing dentist, right?
I'm still practicing one finger dentist, only I do not drill and fill anymore. I do not do any of the things that biological dentists used to do. The happiest day of my practice career is when I got to tell my office manager, hey, you know, when we ran out of those restorative composites, don't reorder them anymore. I don't have to bend over the patient for a living. I deliver DNA appliances and I adjust them just like the way you deliver a partial denture in school. I know you stand up and you face the patient and you stand by their sides. And we talk like, you know, you go to your medical doctor. Only we do it a whole lot more effectively. So we're not hustling. We're not rushed. I will tell you that last year I went to see a patient 3 days a week, and I made more income than I did all the other years as a drill and fill dentist. And here's the best part. I have 4 instruments in my exam pack, 2 of which I hardly ever use. Okay. My power tool consists of a Dremel drill from Home Depot for $69. And my overhead as a result from last year working 3 days on DNA appliance alone was 47.5%.
Wow. That is very nifty thrifty.
Yes. So you get to net as a general dentist twice as much as you were as a drill and fill with, you know, half the overhead, and you don't have the, oh my God, what happened to my neck and shoulders at the end of the day. So low stress, high yield, and great patient satisfaction. I'm no longer going to work wondering, geez, is that bridge or implant gonna fit? What that next patient that was sensitive last week is gonna call me about this week. I wonder instead about, geez, I wonder what patients are gonna tell me about their new breakthroughs. What amazing stories I can share with other people about what this DNA appliance can do. And let me tell you, DNA appliance is not just another mandibular advancement device.
Yeah, that's what I was going to ask you, because there's so many, obviously there's a lot of people teaching treatment for obstructive sleep apnea. There's all these appliances out there. Right. Actually, full disclosure, I actually wear an appliance myself. But I'm always curious about the DNA sleep appliance, right? What is different about it, and how is this different from other treatment modalities and other courses?
Okay, so I liken the maxilla to be the dominant hand in boxing. Right? When you enter the boxing ring and you're gonna fight for your life, why would you tie your dominant hand behind your back with just mandibular advancement devices? All right, so in orthodontics, it's the maxilla that leads and the mandible that follows. Okay, so we develop from the top down. When we're babies, every one of us, when we're born, we couldn't hold up our heads. But our mouth sure could suck for dear life. It is through repeated cycles of feeding, sleeping, that we gain enough strength to finally sit up, grasp things, put it in your mouth, and learn the world through, again, our mouth, okay? So the mandible is movable, but it's the maxilla that is the fixed target that mandible is trying to hit. Mm-hmm. So the maxilla is deficient. The mandible has to retrude. If the maxilla is retruded, the mandible either has to retrude or go into class 3. So every one of the orthodontic concepts about angle classification is useless. What really matters is the maxilla sufficiently developed for the mandible to not have to retrude. Anytime the mandible retrudes, the body pays a price, not only in airway, but also in pain. And I will tell you that, In my practice, 70% of my patients buy DNA appliance treatment for pain reasons and only 30% for sleep apnea reasons. So the TMJ type of a pain, bruxing, kind of a dental sensitivities, people who want to avoid another root canal. This is a great solution. And you know it's a causal treatment because the symptoms go away and never come back. Yeah. So that's where it's different. And also where it's different is that when you treat maxilla as a root cause, the airway, the energy, the face all improve, and the patient appreciate it. In fact, I would tell you that I've had this policy of, you can have my appliance back and I'll give you a full 100% refund at 30 days. Nobody has taken me up on it. Yeah.
Well, let me start that. I mean, you've talked about the impact it's had on you and also your students from a financial aspect. Let's talk about the life changes that you've seen with your own patients doing this.
Okay, so whatever you want to name, I can tell you. I have had patients whose erectile dysfunction got better. I've had husbands who write me a big check, pressing my hands and say, thank you for giving my wife back to me because her low back pain went away and we can roll in the hay in again. I've had people, I've had wives who's been suffering from her husband snoring for 60 years, reach out and had to touch her husband and say, honey, are you still there? He's so quiet now. I've had patients who comes in from looking like they're gray and 1 foot in the grave to looking totally radiant and glowing. I've had patients who became mothers when they had lost babies right and left because their internal environment is not suited for a new life. And we've had several new babies, not through me, but through their own efforts, and her husband, their husbands, they're really happy.
I mean,
and the head, neck, and shoulder pain resolution, the dental, root canal candidate teeth that are slated for root canal that get reversed. Yeah. I mean, those are real joys.
Yeah, and with these patients, I mean, when they walk in the door and when you're done and they come back, I mean, their mentality, probably the way they carry themselves is most
tremendous. Right? It's the greatest satisfaction. I mean, I've had patients who were wheelchair bound and they were able to walk again. I had a nurse with traumatic brain injury. That's on my website, holisticmouthsolutions.com. It's called Jenna's case. Just go visit that and check it out, because she was a remarkable evidence of how much the mouth matters in whole body health. And I would tell you that when the patient can sleep, and the predicate of good night's sleep is that there's no airway obstruction. Mm-hmm. So you have to solve the problem of the 6-foot tiger, 3-foot cage.
Yep.
We dentists,
it's a plug of his book right there, guys. It's on Amazon.
Right. And we dentists are notorious in tolerating malocclusion. And malocclusion is not just, turning crowded teeth into straight white teeth. I'll tell you that some of the worst cases I've ever had to deal with are bicuspid extraction cases who end up with straight white teeth but totally miserable.
Yeah, just closed everything down.
You bet. And
Dr. Lau, so I have to ask you something here.
Sure.
I mean, who has really bad malocclusion? You and I should know this. Is Asians.
Listen, the whole world.
Just Asians alone, I'm sure. The whole that'll grow someone's practice right there.
Yeah. The whole world needs our help. I'm telling you, human beings that grow up in America are de-evolving. I have 2 sons. I tell them if they're going to find an ideal mate with healthy offsprings, hands down easy, find a farmer's daughter from overseas.
Oh, love it.
Yeah.
So Dr. Lau, can we take some questions here? We have some questions
Sure.
from the audience here.
Sure. Please
Okay.
do.
So, and they're fairly easy questions. Okay. So let me ask you this. So, okay, this is kind of could be a very long question answer. It could be very short. So we have this doctor asking, so can you just explain us what the Vivo system is?
What the Vivo system is?
Yeah, well, so that's what they're asking. So maybe talk about from the protocol, like just, I know obviously guys, you know, this is not like a course or anything, but Dr. Lau is going to answer this question. So just talk through the protocol from this oral DNA appliance, like from a guy walking into the office to they're coming back and you just cured them of all these ailments.
Okay, so first you have to understand what it is that you're treating. What you're treating is an issue of airway obstruction as a result of a 3-foot cage forcing a normal sized tongue into the throat. Okay, can we understand and start from there?
Yes.
Then the next thing you have to do is you have to identify what's wrong, right? Which dimension? Every space got 3D, including that space that's the habitat of the tongue between the maxilla and the mandible. This space between, like, 2 pounds. Okay. Now, you as a mouth doctor, let's stop using the term dentist, which your patient expects you to be a tooth doctor for them, but they don't know. Okay, that you can effectively change the 3D of this habitat for the tongue. The tongue does not want to be in the throat. The tongue wants to stay in the mouth. So our job is to put your upper and lower model together, the diagnostic model, so-called. Instead of looking at it in front or looking at it occlusally, look at it from the uvula angle. You need to identify that 3D space. Which one of the 3Ds are off? I mean, is it vertical, floor to ceiling height? Is it side to side width? It's front and back depth. Okay, any of the 3Ds will affect the airway. Okay, so this takes me back to answering this question with this premise. If the space is too small in any of the 3Ds or two or all of the 3Ds, then you're going to use DNA appliance as a adult jaw expander. Now, I don't like that term, but that's what Joe and Jane, average people, can understand. Okay, technical term is a epigenetic redevelopment oral appliance for either the maxilla or the mandible or both. And therein lies a big difference. The Vivo systems is that one, it's not just mandibular advancement. Two, it can expand the maxilla and the mandible and coordinate the occlusion between them. Okay? So in the process, the patient will have more energy and less pain because now the mouth is not a monkey wrench in the body's whole postural chain. And now the patient can sleep through the night. Okay, so it's a system that's been FDA cleared and evidence-based to show that one, the nasal passage will widen, and two, the maxilla will widen and lengthen, and three, the mandible will do the same. Hence, the 3-foot cage now will become a 6-foot cage that is suitable for the tongue to stay in the mouth instead of falling into the pharynx. Does that make sense?
Yeah, it makes sense. So how long does a typical case, like the treatment time?
Okay, so there is no such thing as a typical case, but I will tell you about a third of my patients are done in about a year, although they feel better within the first month.
Wow.
So you don't have to wait until like orthodontics, the braces come off at the end before you can see what you look like.
Yeah, you're just like, oh, wow, my teeth.
Yeah. Here, what you're gonna do, you're gonna, oh my God, you know, when the malocclusion is no longer adversely rippling through the postural chain, all the way from the jaws down to the neck to the back, to the knees, to the feet. Now the patient says, wow, I feel so much better.
Mhm.
All right. So about another third I've done in 18 months. And for the bicuspid extraction cases, there will be, into 2 to 3 years, and particularly in the maxillary retrusion cases. Maxillary retrusion takes the longest time.
Okay, yeah.
So I've treated patients whose maxilla is retruded 17 millimeters.
Wow.
I mean, and those people whose teeth got extracted and spaces further closed, they're really behind 2 8 balls.
Were those Asian patients?
No, not necessarily. Yeah.
Dr. Liao, we got some more questions here.
Sure.
Let me pull that here. We have an interesting one here. This doctor's asking, can you elaborate on the mandibular expansion?
Sure.
Anatomically, what's happening?
Sure. So this is a good question, because when you look at the DNA appliance, you have to drop all your brain damage, as I call it, your orthodontic education. You need to just drop it and start from scratch. You need to think about, not in terms of mechanical breakdown, the bone in front of the on the mesial surface where you want to move the tooth, so that you break down the bone in the mesial and then you deposit bone in the distal. That's not how epigenetic orthopedics works. So think about how a child's tooth or your own tooth is erupting. When the tooth erupts, it erupts with a matrix of bone around it. It's like a tree that comes with its own surrounding of earth attached to the root. Okay, there is a volume of bone that comes up with the tooth. So DNA appliance has got this axial spring system that will stimulate the stem cells. And believe me, there are stem cells in the tooth socket, the periodontal sockets. How do I know that? You're a general dentist. If you do extraction, you'll see that it doesn't fill up after a tooth is extracted with epithelial tissue. What does it fill up with? Bone. Where did that bone come from? Well, there's stem cells in the tooth sockets in the periodontal ligament space. It gets activated. So here we are activating the stem cells around the periodontal ligament space of every tooth, as long as there's no inflammation, with the DNA appliance, so that that bone is coming with the tooth movement in 3D, in 360 degree surrounding. All right, think about how a second molar erupts. It comes with a big volume of bone around it, right? Same thing. As long as there are PDL, there's going to be a fixed amount of bone around it. And what DNA appliance does is that there's a way to activate a genetic blueprint that's inherent in every one of us. So it brings out the best face that is meant for you, Glenn, for you, Fred, or me, Felix. All right. So everybody's got a genetic blueprint that is class 1, as if inside a relationship, and with the maxilla and mandible in harmony. So what DNA appliance does is that it activates that blueprint and actually turns into reality. So we do not turn you into, for example, Brad Pitt, but we turn you into the best version that is embedded into your DNA already. All right. So all the dentists should have the best looking children if they learn this process. And all the dentists should have the best airway if they learn this process. So then turn around and model it for their patients. So does that answer your question?
Yeah, absolutely. I think you over-delivered there. Now, the next question, I'm going to preface with the fact that this is Teresa Scott asking this question, okay?
Sure.
Someone who's actually using this system,
Sure.
a big believer. But I just want to let you know this is coming from her, because it's a question that is pretty much asked of her and probably you and anyone who is using the system, right? So the question is, how do you answer the critics who claim you can't expand the maxilla or the mandible past puberty?
Read my book, chapter 16, 6-foot tiger, 3-foot cage. All the evidence is there. That's number one. Number two, I will put out a blog where I showed in the last time I teach this course that when we get done with, so I had a patient who just came in 2 weeks ago. He had maxed out his DNA appliance. And we took records. We showed that there is no flaring. We showed that after 7 millimeters of expansion, as you can see in the gaps of the acrylic edges, that there are no spaces between the teeth. All right, so we'll post that. So the answer is, one, you have to try it, or else you're not fit to criticize or
Right.
question.
And
right?
also you have the cases to.
Absolutely. Yes.
I love it.
Yeah.
I love it. Well, Dr. Lau, thank you so much for jumping on. I know that, you're a busy man, but I wanted to bring you on because actually, I'll be honest, I have a very little knowledge of this system, and I made sure I didn't research it at all because I wanted to learn it all right here and hear it from you. I've had a lot of friends, they were like, let me show you everything. I'm like, don't show me anything. Okay, I want to come in here not knowing anything so that I can hear it myself and understand it myself. I didn't want to come in here with any biases and whatnot. But at the end of the day, a general dentist can do so much more than just fixing teeth, right? We can really impact people's lives.
When you brand yourself as a cosmetic dentist or an implant dentist, you so shortchange yourself and your patients. I will tell you, if I may take another minute.
Sure.
Every general practice has got a airway practice built into their current patient base. And my advice to you is, as soon as you start taking courses to become a VIP with Vivos, start looking for an associate, because the demand is going to start overwhelming your time and your energy and your interest. And the second thing that I also want to add is that the joy, the reputation, the positive difference that you can make is way, way beyond what you can imagine. You can bring radiance back on older people's faces. You can keep younger women from having childbirth problems, moodiness, PMS, younger men from suffering from ED and going down the wrong path for solutions. You are going to be the most valuable wellness resource in your community, bar none, when you become what I call an airway-centered mouth doctor. Don't just be a tooth doctor. You know, the earth was once flat. That's what we learned from our professors in dental school. But you know what? The earth is round now. We're in the smartphone age. We're in the age of quantum physics. So don't shortchange yourself by staying as an expert tooth doctor. Now, we need tooth doctors. I don't mean to put that down. You got to have sound teeth with no periodontal inflammation or endodontic infection. But we build from there, and we can activate the stem cells around healthy teeth roots and really redevelop this part of us, which no other healthcare professional can do.
I love it. I mean, I can't put it any better than that. So with that being said, thank you so much, Dr. Liao. And also, for those who are watching right now, there was a whole bunch of people asking questions. We couldn't get them through all there. But if they want to reach out to you, what's the best way to reach out to you? To obviously, we have his book. His book is, I'll put a link in here. You can get it on Amazon if you want to just kind of learn about what he's talking about here. But if someone wanted to reach out to you, what's the best way? Is it email? Is it by mail? Or what's the best way?
There are two ways. One is contact Fred.
Okay.
Contact Fred, who will also provide them with a what's next opportunity with Vivos. That's number one. Number two, they can go to holisticmouthsolutions.com. And there's a bubble that will pop up that says, let's talk.
I love it. Dr. Liao, thank you so much.
Great pleasure.
And appreciate it. And I look forward to meeting you soon.
Yes, please do. And thank you for the opportunity to speak to your fans.
All right. Thank you. We'll see you later.
Ciao.
Well, Fred. Hold on. There we go.
There we go.
All right, guys. So anyways, I want to introduce everyone to Fred here. Fred works with Vivos. He is, so many people are already saying hi to you, Fred. It's like, hey guys, you can say hello to me, okay? I mean, come on. You know, I know you see me all the time, but everyone's like, hey Fred, what's up, Fred? So Fred, you know, we just heard, man, I'm impressed. You told me, man, you're gonna be impressed with Dr. Lau. And you know what? I felt like I was talking to one of my uncles, man. He was like cracking all these jokes. I was trying to be as professional as possible, but I love it. I love his sense of humor, but really I love the fact that he loves what he does. He truly loves what he does. He truly feels he's making a difference. He truly feels that he wants to really help other dentists out to kind of fulfill their potential and take care of these patients. So Fred, let's do this. Like, actually, I'm actually gonna bring John on too. Hopefully he's not sleeping here. John's probably like, I'm just like chilling out back here. So anyways, I'm gonna bring him on. Hey, John. John, well, John, just finish what you're eating here. We'll go talk to Fred here real quick. So Fred, here's the thing. We learned all the life-changing, just learning how to change people's lives, right? Now, how do you go from where I'm sitting? Because literally, I made sure that I didn't research anything. I wanted to hear this for the first time. I'm impressed. So how do we go from where I'm sitting to where Dr. Liao is sitting? Obviously, we can't be like him, but we can treat the same patients he's seeing. So how do I go from here to there?
Sure. So a little bit of background on Vivos, just so I can, just for some edification. When Dr. Singh wrote his book in 2004, it was called The Spatial Matrix Hypothesis at the University of Michigan. And then he patented the DNA appliance in 2009. And when he went out, he went and trained about 1,000 doctors through classroom training and treated about 10,000 patients that way. But what they found was only a small percentage of the doctors were ever prescribing the DNA appliance. And the real reason was they never got any business support. They never got any clinical support. They never got any help with the complexities of, maxillary hypoplasia and what do I do with this patient? What do I do with that patient? It was kind of like you do the classes and then have a nice life.
Yeah, just wing it, right? Just go, go do it.
And if you talk to Dr. Liao, he calls it hacking his way out of the jungle, right? So when Dr. Singh met Kirk Huntsman, they had this idea that they could take the business acumen that Kirk had acquired through Dental One, apply it to the life-changing treatment modality that Dr. Singh had, and put this together and help dentists really move forward. And so originally what they were going to do was open up airway clinics, and they were going to have airway only clinics. And they opened up about 5 of them. And then when they decided to go public, which we're going to go public here in the next couple of months as an FYI, the Wall Street guys said, hey, there's no way for you to meet the addressable market, the obstructive sleep apnea patients out there, opening up these clinics. That's too expensive. You can't open them fast enough, etc. You need to kind of transition your model to what we call the Vivos integrated practice, meaning that we take all of that information, walk into your office, Dr. Vo, and say, we can give you everything you need, turnkey business solution, so that you can start treating obstructive sleep apnea patients. And that's everything from education, mentorship, practice management, marketing, medical billing, ongoing education, and financial support. So all of those things are now available under the Vivos integrated practice where they weren't previously. So what you get with the Vivos integrated practice is, of course, education, first of all and foremost. 35 hours of clinical CE, continuing education, 24 hours of practice management CE, so for your practice management. Now, I'm sure that if we asked and polled everybody on your group, everybody or a lot of them have paid a consultant at some time or another, or are continuing to pay a consultant $2,000, $3,000, $5,000 a month to come help them with operational efficiencies. Well, we provide you this integrated network, which includes a practice coach or a practice advisor, 188-page manual, 24-step practice management solution, someone that comes into your clinic and helps you implement the back end of this thing, as well as, of course, all the clinical education. And then, of course, you have what's called an integrated market advisor, somebody like myself or John, that is there to help you grow your professional network with ENTs, naturopathic physicians, DOs, other people that are going to be your referral source. Then we give you everything you need to know about medical billing, because we are treating a medical disease with a dental solution. And therefore, you really need to bill medically. And so we give you all the tools, help desks, paperwork, everything, training for medical billing. We also give you a bunch of what we call marketing toolbox. That's going to have a bunch of branded, white labeled stuff for you to use for external marketing as well as internal marketing. We help you do a launch event that we pay for. And then we have a learning management system that has about 90 different classes. And then, of course, all of the training is done at the Craniofacial Institute in Denver. And one of the things that's offered there is training all year long. And not only do we train the doctors, but we train all their staff. And that institute is open to you and your staff, unlimited use for the first year. Not only do we have our core courses, we also have elective courses. So the core courses are segmented into 4 separate 3-day sessions: intro to adult, intro to pediatric, and integration, and then advanced cases. And each of those is a 3-day session, so basically 12 days. And then we have a lot of elective courses: marketing 1 and 2, medical billing 1 and 2, laser frenectomies, phase 2 ortho, patient financing, all these things. So all of those are open to you and your staff for the first year, unlimited use. So if you have staff turnover, if you have a new associate that comes on, you can just, send them there. So that's how you get involved. And once you get through that process, then you're what we call a Vivos integrated practice. And the way that it would work, you would go to session 1, intro to adult. You would then treat you, friends, family, spouse, that kind of thing. Then when you come to session 2, you're going to deliver that appliance, and then you'll start learning about pediatrics. And really after those first 2 sessions, then you're really kind of getting the hang of designing the appliance and all that stuff. What we have is called the Vivos Cloud, which is what we call the Vivos Intelligence System. And you're going to take all of your diagnostic records, you're going to upload those, you're going to get back a PowerPoint presentation that you can use to show your patients and close the case with. And then all of those records are housed in the cloud, and it'll be the largest obstructive sleep apnea database in the world, and they'll be doing a lot of research from that database. And just as an aside, Stanford University approached us. We signed an agreement, and we will be doing a medical clinical trial with Stanford University on obstructive sleep apnea. The IRB is complete, and we'll probably be enrolling patients in the fall. And we also signed a dental clinical trial with Midwestern University on the dental side, and also the IRB is approved. We have another a 510K filing with the FDA for more clearances. And anyway, we have lots of science, lots of stuff, and you're privy to all of that through the VIP program. So it's quite a lot.
So, John, I'm going to ask you this question here. Why does Vivos offer all those things?
Because our mission, Glenn, is to rid the world of sleep apnea. And it's a big mission, and we've only begun to scratch the surface. And as I'm listening to Fred describe the program, and he did it well, that is really only the beginning. The doctor training and the staff training, it's really only the beginning of the journey, because the ongoing clinical mentorship and the growth that doctors will embark on is key. And as we begin to treat more and more patients, this is going to become, I believe, standard of care. That when we have patients that are diagnosed with OSA, this is going to be viewed. Our goal is to make Vivos DNA the gold standard, like CPAP is now when somebody's diagnosed with obstructive sleep apnea.
Yeah. And I'm going to address this to all the dentists that are watching. So guys, if you're watching right now, just type in the comment section any questions here. Obviously, Dr. Lau is very busy, so he had to jump off there. But anything as far as the program and all the protocols and all these things that are in the system to help you succeed. Just go ahead and ask any questions there. But, you know, this is actually all the dentists. You know, I've taken CE courses before and I learned something amazing, right? Clinical procedure. And I learned it and I go home and I feel good about myself. I come in Monday, I look at my team like, guys, we are going to implement it, man. We are going to basically kick some ass. Okay, who's ready to kick some ass with me, right? And everyone's like, yeah, right? And then Tuesday comes by. And Wednesday, and then then I get my manual. I just put it on my bookshelf. I'll look at that when I'm ready, right? Friday comes by. Before you know it, 6 months goes by. And I don't even implement any of those things. And it sounds like with Vivos, you guys have so many things that are added on, right? To take pretty much all the excuses out of there. Okay, I don't know how to do this case. Okay, well, here's the training. Oh man, I can't get my patients to pay. Well, here's some medical billing. Oh, I have a hard case. I don't know. I don't have anyone to talk to. Oh, you know, you got these mentors here. Oh, well, you know what? I got some harder cases. Okay, well, here you go. Oh, well, you know, what else can I do outside of this? Oh, we got some electives. So it sounds like you guys, oh, another big thing is I don't know how to market it, right? I noticed that you brought up multiple times, there's like the PowerPoint to close the cases. There's a marketing kit that is white labeled, right? That you can change it, put your own private label on there. There's all these marketing things that you put on there, because at the end of the day, knowing how to do the procedure is just one part, right? Then you got to present it. That's another part. But then it's like, you got to get those people in the door. Well, you can only treat your family so much, right, guys? And so that's what's really, really amazing about this. Okay, so let me look to see if there's any other questions. And yeah, we have, oh, okay. Well, this is an interesting question here. What is the cost for a patient that you guys seen with all the clinicians you worked with? Someone wants to know.
Sure. So there's when I say the average, you have to be careful there, because pediatrics come into play here.
Sure.
So the pediatric cases are less expensive than the adult cases, but the average case reimbursement, or the case cost system wide, is $7,300. Now, most doctors charge around $8,500. So the way that our training center works is, if you're a cash pay, it's $7,500, and if you're using insurance, it's $8,500. Now, I have clinicians that are in Manhattan, 2 of them in Manhattan, and they're charging. One is charging $12,000, and the other one's charging $15,000. We have another clinician here in the East Valley. I live in Scottsdale. They're charging $10,000. So, you know, everything is dependent. And then as far as medical reimbursement, medical insurance is all dependent on state and insurance, right? Depending on Blue Cross Blue Shield in Texas is different than Blue Cross Blue Shield in Colorado. But on average, we're seeing 20 to 80% reimbursement, depending on the type of insurance that you have. Now, Medicare, you don't get anything. It's like $1,000 or $1,200.
It's true.
But here's the big advantage for patients. I'm going to tell you this, and every doctor that realizes this gets the idea. When the patient comes in and they look at their 3D cone beam and they see they're breathing through a straw, it's very visual, right? And they see they've been grinding their teeth, and you go, by the way, if you use this treatment protocol, it's usually 15 to 18 months, could be a little bit longer, most likely never have to wear another device again. All of a sudden their mind shifts. Really? There's an end date to this? And we have lots of clinical trials where our AHIs are below 5 or below 8. Their bruxation has ceased, their TMD is gone. So when they see that and they feel better, like Dr. Liao said, within a couple of months, it is not difficult to close cases. And Dr. Liao does a great job of instructing when he's talking about the classes and how it works. But it's really, you have to leave everything you know about dentistry kind of at the door, because you're treating obstructive sleep apnea. And we give you everything you need to be successful.
So John, I'm actually going to put you on the spot here. Okay. So I've been throwing some softballs at Fred, but I'm going to throw a speedball here to you. So John, I mean, you obviously we connected, months back, and we have some mutual friends who know you. And I want to ask you this, as someone who's kind of in the trenches and talking to all these doctors and having doctors come into the course, what would you say the percentage of doctors who just said, you know what, John, just forget it. This is not for me. This is not going to work for me. All the people that you've seen that have gone through the system, how many people have just said, this is not going to work for me? It doesn't make sense to me. How many of those people?
How many people that I've presented to, Glenn?
Yeah, or that that's gone through, because that's the thing. Like sometimes people say, "Oh man, this is too hard, and I can't wrap my head around that." And I know people like Dr. Shannon McCarthy, who just said hi just now. She's like, "Oh, this has changed my practice." Obviously, Dr. Teresa Scott, but for every Shannon, for every Teresa, I mean, how many docs said, "Oh, this is not working for me"? I mean, I'm sure you guys track that. Like,
yeah, and I don't know the percentage, Glenn, but it's probably less than 5%. Mm-hmm. But it almost always is the doc that a couple things. They don't bring their staff, so they come to the training just on their own, and then oftentimes it'll be a long time between trainings. Right. In other words, it's not a priority. And that, like Fred said earlier, this is not dentistry, and it's not just another dental procedure. So if you want to do, and Vivos is not for every doctor, and we're not looking for every doc. Our mission is big, but we're really looking for a doctor and a practice that are going to make this a priority and make the appropriate changes that are necessary to make it successful. And I've had to talk to docs before that when we really get down to talking about it and what their commitment is, I've had to tell them, I'd love to have you as a doctor, but it may not be right for you. And
I love that you say that, John. See, and that's why I threw this question at you. I love that you say that, because at the end of the day, just like with anything, it doesn't match up to everyone. I mean, you rather part as friends with someone than have them go through this program and not succeed. And there's a lot of success stories there. But I love the fact that you say that, because people are thinking, okay, well, that's the investment. They just want to pull a bunch of people and just herd them out. But you guys want the right people in there, because at the end of the day, they're able to help more people. I love that you answered it that way, John. And I'm going to throw an easy one. Actually, I already know the answer to this, but I'm just going to ask it. So they asked it. I don't want you guys to think I'm ignoring you. Do you need a cone beam to do this?
So you don't need one. You can send it out for imaging if you want. You can do the mobile imaging guys, but I would say this. 3D, I'm going to say this from the global view. Mm-hmm. The dental practice of today, if you continue what you're doing, will be obsolete in 3 to 5 years.
I agree.
If you don't believe me, when's the last time you bought a plasma TV, right? Which was prevalent technology 5 years ago. When's the last time you bought a Garmin GPS to put on the top of your dashboard?
Hey, what about your phone?
Your phone, exactly. When's the last?
I mean, I gave my daughter my old iPhone, and she just gives me this mad face all the time, which she hasn't used it. Right. And I'm like, wow,
this is old, right? And so you have to change. So if you're not into 3D cone beam, I mean, your diagnosis could be off, right? 2D is not the way to go anymore. You can use 3D for everything. And by the way, if you learn how to bill properly, you can make a lot more money. As a simple example, if you do a pano, what are you getting reimbursed for? $70, $90?
Mm-hmm. Yeah, $70.
You do a 3D cone beam, it's $328. Same amount of time, get a more accurate diagnosis, and you're making more money. So these are the things that we teach you, how to make more money using that in other parts of your practice, not just with the 3D imaging with the DNA appliance.
And I'll say, Fred, that we have doctors that start out with Vivos and don't have a cone beam. So they get their training started and they use a mobile unit or they send it to an imaging center. But when they start screening and closing 2, 3, 5 cases a month, it becomes very evident to them that they need that, and it just takes the practice to the next level.
Well, guys,
when you send somebody out the door, the opportunity is that you would lose them. In this way,
luckily for everyone in this group, I have the Nifty Thrifty deals for cone beams. Okay, guys, we already got that. So really, the prices I get for those there's really no excuse for you guys not to get one. But the next question is actually a perfect segue into what I'm gonna put on you, Fred.
Sure.
And someone just asked, well, is there an introductory class? Like, how do I start here? Well, I'm glad you asked that, Doc, because now I'm going to ask Fred, because he's in the Nifty Thrifty Dentist group here. And Fred, come on. I mean, we're here. We're trying to save some money. Everyone's getting excited. I mean, I think that I'd like to think that everyone was here to see me, but I think they were here to see Dr. Lau. And now they're sticking around because they know what I'm going to do here. So, Fred, okay, all these docs I want to jump on. What can you guys do here? What can you guys do to really get these docs on and really start implementing this in their practice?
Well, so as you know, everybody would like to work with you, right, Glenn? They like to train with you and be around you and hang out with you. So what we're going to do is next month in Florida at the Gaylord Marriott, 2 miles from Disneyland. You and your partner and your wife are coming down. So we're going to invite all of your Nifty Thrifty doctors to come on down, and they can come to the Gaylord Marriott from the 11th through the 14th in Florida. Food and room and food, plus their CEs, everything included, $895.
Wow.
Now, if they show
everything
up,
included. That's the food in the hotel.
Food, hotel, pass, CEs, everything.
How many hours of CE?
More importantly, 8 hours of CE.
Okay.
More importantly, if they come, we're offering a fast track training. So they can go through this fast track training, and when they get done, they're going to have their 8 CEs. And rather than having to spend 6 days in Denver for 2 separate trainings, they can come to Denver for 1 3-day training and have been complete for sessions 1 and 2 and be able to start prescribing the DNA appliance.
Well, it's like a fast track.
It's a total fast track. It's really cool. I know you're going to do it, and Dr. Hoffpower. And what we're going to do is say, hey, come on down, and we're going to basically show you everything we've got. And if you show up, we will refund your $895.
Wait, hold up right here. Wait, hold up. First of all, I want to warn you guys, you're on video now. So whatever you say, it's going to stick, or else the people are going to come out with their pitchforks and torches. So you just said that, number one, there's a fast track course in Orlando at the Gaylord. We're not talking about like Motel 6, right? This is the Gaylord. No. It's nice. Bring your family. You go to class. They go to Disneyland.
Send them to Disneyland. Yeah,
they come back, and you're a hero, right? So I love that. I love being a hero. Okay, so you come there. It's $895. Hotels included, food's included. You get the CE. But you just said that if they just show up, and no matter what they do, they get that money back.
That's correct.
Even if they don't sign up.
Even if they don't sign up. Here's the thing. John just said we don't want everybody. I always say I spent 10 years in the Army. I was a special operator. So I wish we had the slogan, but we don't. We're kind of like the Marines. You know, they want a few good men. We want a few good dentists. So if you show up, here's the thing. It's a win-win. If they go through all the sessions and they realize it's not for them, they can't unlearn it. But we will give them the list of all the other providers that they can send their patients to and treat them appropriately, right? And so it's win for their patients. And they got the knowledge, they can screen their patients, they can look at it. They may not just want to have to go through all the stuff. So it's fine. If they show up.
I mean, it's literally like, I mean, you're not taking, it's risk-free. I mean, you come here, you'll find out if this is for you.
We give you everything we got.
And then you're like, hey, it's not for me. Hey, doc, go spend time in the pool. Thank you for showing up.
It's not just risk-free, it's free.
That's right.
Yeah, literally.
Yeah. It's free.
Yeah.
Okay, so look, I can already tell you that I'm not going to be one of those docs that says, thank you, I'm going to go to Disney World with my kids. No, I'm going to want to keep going here. So
yep.
I'm going to put you on the spot again. Okay, so if they want to go through the whole protocol, right? You got to hook us up with something for all these docs that'll come out there and they want to keep going.
Yeah.
What can you do,
if
Fred?
they can come down, yep. So basically, depending on their time frame. So we finance everything, of course. So basically, for $600 to $800 a month, depending on how long they want to finance, that'll pay for their Vivos fee. And then we work with professional dental services, cone beam supplier, and if they want to package it, it's there's great packages available, you know, with Kim and Brandon and you have people. It's very simple. So basically you're getting in for $600-700 a month, and that runs either 48 months, 60 months, 90 months. There's no prepayment. You can pay it off at any time. So very, very inexpensive.
So I'm going to put you even more on the spot,
Sure.
even more on the spot here. So, all right. So yes, there's payment terms there, and there's financing and all that. So number one, I'm gonna put you on the spot. What is the normal fee?
Sure.
The normal fee
is now $65,000.
$65,000, right? For something that, you know, you're doing cases at least $7,500 a pop. But look, you're in the Nifty Thrifty dentist. Fred, I'm just gonna twist your arm some more, man. I mean,
You want the total?
What can you do, man? Come on, like what can you do? Like
the total is 40 if you do it. It's pretty simple. Now you have to do it between now and the end of the conference. If you do not do it we talked about this the other day. If you don't do it by the end of the conference, the price will go up. We'll still give you a Nifty Thrifty deal. It just won't be this.
It just won't be this sweet of a deal, basically.
That's right. Exactly. So this is like the one-time offer between now. So what I would suggest to your Nifty Thrifty dentists that aren't able to go, they can schedule time with myself or John, and we'll do a webinar. I'll bring on Dr. Caulfield. I'll bring on Dr. Liao, whatever they need to get comfortable to take advantage of the deal. But after the conference,
I was going to throw this out to everybody. So first of all, you can pay $65,000, or you can take advantage of this nifty deal and get it for 40, right? If you're not sure, if you want to learn more, we'll come to the course in Orlando. I'm going to be there. Chris Hoppower is going to be there. It's $850. Is that what you said? $895?
$895.
Now, $895. Okay, it costs $895. But you know what? If you show up, if you show your face and go into the courses and really listen, and if you don't want to go through with it, they're going to say, well, thank you so much, Doc. Here's your money back. Go have fun at Disney World, right? I mean, so
we got a couple other offers. So if the spouse wants to come for show pass and food, it's $495, right, John?
$399.
$399. I'm sorry. Wow. And then if you want to bring an associate or your airway specialist or first chair, whoever you want to bring from your office, it's $895 as well. We don't give them their money back, but $895. It's we're actually losing money. You know, you can imagine.
Oh yeah, at the Gaylord, yeah.
Yeah. So we want you to come. We want you to bring your staff. We want to give you we want to take away all the obstacles to get you there. So this is the best deal that anybody in the world is ever going to get at any time ever. So and there you go.
So Glenn, I thought you'd ask me the hard question of how can we give away this Orlando event? How can we afford?
Yeah, I was just waiting for Fred to stop sweating there for a second before I do that. But John, thanks for bringing that up. Yeah,
we are so confident and excited about what we're doing that we know that when this room full of doctors sees our training and sees our before and afters and hears the testimony and videos of our doctors and their patients, they'll never be the same. And we just need to expose what we do to more people. And we're excited and honored to do it.
I love it. I love it. So guys, I'm actually going to be there at this event. So, you know, I would love to have everyone in Nifty Thrifty Dentists to be there as well. Let's take the course together. Let's take the course together. And as we move on, you know, if you decide to sign up and we move on and go to Denver, take the additional courses, that'll be something neat, right? We're doing it together. We can talk in the group about what we're learning, how it's changing our practice, but really they lower the barrier here significantly. And that was the one thing when I met Fred, when he was in Dallas, I said, look, Fred, I understand what the price point is. I understand what you guys bring. You guys bring a lot of value, but really, I really want to get my members on this. What can you do? And Fred worked really hard and John worked really hard. They came back with this. And when he told me this, I actually was shocked. I thought, okay, I don't know if Fred is drunk. but let me get him to email it to me so that I can just hold him over it. But no, he wasn't drunk. Everyone over in Vivos, they are so confident that once you guys come to this course, once you actually listen, that it's going to change your life. So guys, thank you so much for jumping on.
What I'll do is, if you want, I can give it to you now, or I can email you the code to use to get the deal I just mentioned.
Yeah, so I'll get all that information, guys. I'll post it in the comment section. I'll make another post the next day. And if you guys want more information, if you want, maybe you have questions that I didn't get to, and maybe you want a webinar of some sort, post it in the group. I'm going to look, and maybe I can talk to Fred and John, and maybe they can facilitate another webinar that they can spend a little bit more time answering questions, because I know we went through there. But look, if you guys come to the event in Orlando, there's going to be plenty of people to ask questions. Like, if anything,
people that'll be a lot smarter than me answering questions.
And if anything, if you are not sure about this, I promise you, when you leave Orlando, you'll know exactly what you're getting into, because most of the clinical instructors are going to be there, right, John?
That's
all
right.
Of them.
That's right.
All of them.
We'll talk about our studies. We'll talk about the science. Dr. Singh will present. Dr. Liao will be there. All of the instructors from the Craniofacial Institute will be there. So we're basically, in the military intelligence realm, we used to say we're dropping our fig leaf. You get to see everything.
I love it. I love it. Well, Fred, John, thank you so much for staying on. I know we started a little late and I kept you guys up, but thank you so much for sharing your time with us. And guys, keep typing in the questions into the comment section. I'll put all the links and whatnot. And if I see some specific questions, I'll tag Fred on it. And if Fred can't answer it, he will get someone who can. So guys, thank you so much for jumping on tonight.
Thanks, Dr. Vo.
Thanks, Dr. Vo. Appreciate it.
Good night, everyone.
Good night.